my SFA is completely blocked and I have a full metal jacket. Is that what they call it?
Yes, that's a lot of
Yes.
stents. Yes.
Yeah. So, and I'm doing really well considering. But behind my knee, sort of like when I'm driving, I kind of am getting a pain, or when I sit. And lately, when I'm walking, I am. And I never had pain before, and I don't know exactly where the stents are, 100%. But I'm wondering, can they move? Can they slide down? Because why would I have, like, it's almost like I can feel the stent now, is what I'm trying to describe. It's not pain like, well, I have claudication, but that's not what I'm actually feeling something there.
Yes. So the short answer is, yes, you can feel a stent. Now, imagine when you're standing straight or when you're lying on the cath lab table, your femoral artery, it's not completely straight. We're looking at it, just as Kim said, in two dimensions, but actually it comes down from your groin and is this lazy F as it makes its way into the popliteal artery. Now, when it makes that lazy F and you put a stent, the stent takes that form. But when you bend your leg above the knee, the whole artery bends up. And if you put a stent
Oh,
that's very stiff, that stent kind of tries to stick out through the artery, and that is what you feel. Now, there are different types of stents that are a
what
lot more flexible.
does that
Go ahead.
signify a problem? That it's been a year since I've had the my stent, all of them. And I never had any, sorry, somebody sending me stuff. And I've never had this sensation until like in the last 3 weeks. So is that usual, or is it something to be concerned about?
I think it'd be warranted to get an ultrasound to start
Yeah.
making
And
sure
I'm
that
due anyway.
just beyond that stent, there's not a buildup of plaque, because that's what tends to happen after the stents. We have more buildup of plaque. It has to do with the flow. And if that's causing a problem, or it has the stent itself, because you go up and down, stents can fracture. It can fracture. It's been described in every single stent can fracture.
Oh gosh. Okay. All right. That's scary.
Well,
All right. Thank you.
but they don't go down your leg. They could fracture inside the artery. And if we really zoom in when we're doing the angiography, we can see that the struts of the stent, they basically came off a little bit. And that's something that we keep an eye on. We can always treat that.
Should I, because I am due for my ultrasounds in about, I don't know, 2 weeks or something. Should I let my doctor know in advance that that's something maybe they want to be looking extra hard at? Because,
Well, I would say
otherwise,
if you gave
mhm,
him the description that when you have your leg bent, you have the sensation of something pushing or that
right.
something in the back of your thigh or behind your knee, when you have your leg bent, not straight, that should automatically be that light bulb of, is that stent itself causing decreased mobility in that artery and the stent is, protruding or
Okay.
causing too much force there. Yes.
But I mean, it's something I should alert him to so that when I'm having the ultrasound, the stenographer or whatever they're called, the
Yes.
ultrasound person is looking for that.
They could look for it. Now, the big thing that they're going to look for is after the stent, what does the flow look like? Is it turbulent? Just like Alan was saying, is it turbulent? Does it have very high flow, significant maybe stenosis right after it?
But I mean, they're looking for that regardless, aren't they? Or would they look
Yes,
extra
every
hard
time.
if I alert my doctor? Okay.
They'll probably look extra hard if you tell them.
Okay.
Yep.
All right.
What can be done if her stent is bent? What if it's fractured? Should she do something about it?
Short answer is yes. We know that there's a direct correlation with stent fractures and stent failure. Now, you can stent within a stent. That can be done. And there's where the consideration for more flexible stents plays a role. But it'd be difficult to see. Now, if Marsha is as mobile as she says she is, she would absolutely benefit from a more flexible stent. Absolutely. Absolutely.